Okay, folks. So we're discussing senior care assessments for discussion C. Give me a minute to set up for the show, and I'll be right with you, please. Okay. A senior care needs assessment is a structured evaluation designed to identify the specific areas where an elderly individual may require assistance to safely and comfortably continue living at home. Here is a breakdown based on the surrounding page content from In Home Care. Okay, number one, headline: Purpose of assessment: to gain clear understanding of a senior's physical, cognitive, and social needs, uh, to tailor in home care services that address those needs effectively, to reduce stress and uncertainty for family members making care decisions. What it includes. Okay, I'm going to go through these now for you too. The assessment covers multiple domains to build a comprehensive care profile. Folks, this is how we come up with people's care plans. So I'm going to go through that for you now. All right, so the assessment covers multiple domains to build a comprehensive care profile. Medical review: current medications and their purposes. Medical history and list of healthcare providers. Functional abilities: physical and cognitive status, mobility and ability to perform AD activities of daily living, ADLs, folks. Home safety, risk of falls, safety features, e.g., grab bars, clutter levels. Okay. Mental and emotional health, memory and decision making capacity, signs of isolation and depression, nutrition and daily living, food availability and storage, ability to prepare meals, to shop, financial and legal readiness, bill management and financial vulnerability, legal documents like wills, power of attorney, those kinds of deals also help with assessments. Why it matters. Helps identify gaps in care, such as transportation, mobility, and social interaction. Guides families in making informed decisions about home care services. supports proactive planning to avoid emergency situations or unsafe living conditions. Would you like help designing a customized assessment framework for a specific population, say those with cognitive decline or post concussion recovery needs? A senior care needs assessment can be flexible can be flexibility applied across a variety of situations to ensure that care is both responsive and personalized based on the page contents. Here are several scenarios where this assessment proves especially valuable. Number one, post hospital discharge. Application: evaluate recovery needs after surgery, stroke, or injury. Focus areas: medication management, mobility support, home safety modifications. Outcomes: prevents readmission by ensuring continuity of care at home. Okay, cognitive decline or dementia. Application: track changes in memory, decision making, and emotional health. Focus areas: mental status, safety risks, e.g., wandering, caregiver support. Outcome: enables early intervention and memory friendly environment planning. 3, fall frailty or fall risk. Application: identify physical limitations and environmental hazards. Focus areas: functional abilities, home safety, nutrition. Reduces outcomes, reduces fall risks, and supports aging in place strategies for financial and or legal transitions. Application: assesses readiness for managing bills, legal documents, and estate planning. Focus areas: financial vulnerability, power of attorney, and wills. Outcome: promotes autonomy and protects against exploitation. 5, social isolation or emotional distress. Application: detect signs of loneliness, depression, or anxiety. Focus areas: emotional health, social engagement, transportation access. Outcome: connects seniors with community resources and mental health support. Preventative health planning. Application: use as a routine checkup tool to anticipate further needs. Focus areas: nutrition, mobility, and cognitive health. Outcome: supports proactive care and long-term wellness strategies. Would you like to explore how this framework could be adapted for use in adult daycare programs or smart housing environments, Conducting a senior care needs assessment involves a thoughtful step-by-step process to ensure that all aspects of a senior's well-being are considered based on the page content from in-home care. Here's how to approach it. Step-by-step guide to conducting the assessment. 1. Prepare the environment. Choose a quiet, comfortable setting, ideally the senior's home. Ensure privacy and minimize distractions. Bring a checklist or digital tool to record observations. Engage in conversation. Start with open-ended questions to build rapport. Ask about daily routines, preferences, and any recent changes in health or mood. Involve family members or caregivers when appropriate. 3. Review medical information. Document current medications and their purposes. Note chronic conditions, recent hospitalizations, and healthcare providers. Ask about pain levels, sleep quality, and follow-up care needs. Assess functional abilities. Observe mobility, balance, and ability to perform ADLs, bathing, dressing, eating, things of that nature. Evaluate cognitive status through simple tasks or memory questions. Identify any assistive devices used, walkers, hearing aids, etc. Evaluate home safety. Check for fall risks, loose rugs, poor lighting, clutter. Look for safety features, grab bars, smoke detectors, emergency contacts. Assess accessibility, stairs, bathroom, layout, kitchen, usability. 6. Explore mental and emotional health. Ask about mood, social interactions, and feelings of loneliness. Look for signs of depression, anxiety, or confusion. Consider screening tools like the geriatric depression scale if needed. 7. Review nutrition and daily living. Inspect food storage and availability. Ask about meal preparation habits and grocery access. Note any weight changes or dietary restrictions. Discuss financial and legal readiness. Ask if bills are being paid on time and if financial help is needed. Review legal documents, power of attorney, living wills, estate plans. Identify any concerns about fraud or financial exploitation. Summarize and plan. Complete findings into a care profile. Highlight areas needing immediate attention versus long-term planning. recommend services, e.g., home care, physical therapy, social programs. Would you like a printable or digital version of this checklist tailored for memory friendly or frailty aware environments? I can help you design one. Senior care needs assessment plays a crucial, pivotal role in shaping personalized and effective care planning. Older adults, drawing from the page content, here's how it influences care decisions. How the assessment guides care planning, identifies specific needs by evaluating medical, functional, and emotional and environmental factors. The assessment pinpoints exactly where support is needed. This ensures that care plans are not uh, genetically but tailored to the individual's unique situation. Prioritize interventions. In urgent issues like fall risks or medication management can be addressed immediately. Less critical needs, such as social engagement or legal planning, can be scheduled for follow up. Aligns services with needs. Results guide the selection of appropriate services such as physical therapy, meal delivery, or home modifications. Help match the senior with caregivers who have the right skills and temperament. Support family decision making, provides clarity for family members navigating complex care choices, reduces emotional stress by offering structured overview of what needed, and why, enables proactive planning, anticip- anticipates future challenges, cognitive decline, mobility loss, and builds preventative strategies. Okay, guys, so that is it for tonight. I will see everybody tomorrow for shows. Until then, Gator Wellness, take care, folks.